Hi everyone, I'm Jasmine Buan and I'm back again in another video of Dr. Contessa, and I just want to say how fortunate I am to be invited back here for another episode, because for those of you who don't know or for those who are new to her channel, I was featured in another video titled How to Have a Korean Nose, and in that video I had my first ever procedure done and it was nothing but success. And I'm healing perfectly well, and I'm very happy with the results, and I would definitely do it again. However, in the video, it was noticeable that I had several pimples on my face and pimple marks around my chin area and on my cheek and some on my forehead. And to be completely honest, I was embarrassed of myself, but Dr. Contessa to the rescue. She wanted to remedy my situation and get rid of my pimples and some of my pimple marks. And also, she wanted to kind of complete that that total Korean look, since I already had my Korean-inspired nose done. So a more fitting and perfect addition to it would be, ano pa nga ba, the famous Korean glass skin, which is basically a poreless, flawless skin that is glowing and shiny but not oily, and an overall healthier and even looking skin. So nowadays, more people are focusing now on how to improve the quality of their skin, as they should, because we will only ever have one face in this lifetime, so it's important to take care of it and treat it as an investment alongside with our physical health and of course our mental health. So it's been exactly 3 weeks since we shot the video on how to have a Korean nose, and since then I've been taking medications to treat my acne as prescribed by Doc Contessa, and so far my skin has massively improved. I haven't had any pimple growth in the past weeks, and some of my pimple marks have faded slowly, but some still are left from my previous pimples. But overall, I'm very hopeful for my face, and I'm actually very happy about it because it's just better looking as compared to before. So in today's video, Doc Contessa will be demonstrating on how to have a glass skin on my face. So if you guys are interested on how to achieve a Korean glass skin, just keep watching. So guys, don't forget to click the subscribe button and click the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up with Miss Jasmine Buan.
Hi again everyone.
So welcome back, Jas. Yan, so she has shared to us about the experience on the non-surgical nose lifting, or the so-called how to achieve Korean nose. And thank you, Jazz, for sharing with our televiewers about that wonderful experience. And I can really see a great improvement, right?
Yes po.
Yan. So far, so good. And I think right now, ang nanonotice ko na kay Jazz, nag-glow ang skin
Opo.
compared before. Kasi Jazz came to CSA for a consult on acne.
Acne po.
Yan, pimples. And I recalled, meron kang mga acne,
Around my chin area.
mostly,
Dito,
mostly sa kanya U-zone. So, meron din sa cheeks, right?
Okay.
Tapos, most of the time sa chin region. And a little bit jawline. So, yun yung tinatawag na U-zone, location of the acne. The others naman, T-zone. The others have T-zone type of acne problem. And the others, U-zone. Pag U-zone kasi, we always associate it with hormonal problems. And that's why we did medications. We had treatments for Miss Jazz, right? So, I gave topicals. And we also did some facial treatments,
Yes.
and we combined it with the Lucid laser carbon peeling, remember?
Opo.
Para mag-clear yung mga marks from the acne. And I also combined ng isotretinoin with that of the hormonal treatment. And appreciate na natin ni Jazz yung result, right?
Sobrang nag-improve po talaga.
Yeah. And na-notice ko yung mga pores parang naging finer as compared before. Kaya ngayon, ang pag-uusapan natin will be how to achieve a glass skin-like or a glass-like skin. Yon, how to have that radiant skin, glowing skin, well-hydrated skin, healthy-looking skin. Kasi the others have a lot of concerns yung sa skin nila. Yung iba sabi na dull ang skin ko, rough yung skin ko, dry, dehydrated, walang luster, doesn't look healthy, it doesn't glow. So maraming ganun ang mga concerns, especially right now, stress na stress ang maraming tao. So their skin is like suffering those stressful hormones, right? So I think it's a very relevant topic right now, how to really have that healthy, young-looking, radiant, glowing skin. Yun ang magiging topic natin today. Kasi I'm so happy with Jazz kasi na-achieve namin yung desire namin na mag-clear skin talaga, transparent like. Tapos wala kang makikitang mga spots, dark spots, or blemishes, particularly from the pimple. Kasi the others, aside from acne, syempre magiging concern na nila will be acne marks. Diba? You're treating the acne, but then after that, acne mark naman. So what we wanted to achieve for Miss Jazz, yun nga yung tinatawag na glass skin, radiant skin, well-hydrated skin, glowing skin. So at ating ipagpapatuloy ang discussion sa pagbabalik ng CSA Medical Aesthetics. And we're back mga ka-CSA. So we're going to perform a first procedure for Jazz. This is to achieve glowing, radiant skin, and of course, always youthful skin. And I have here my Lucid laser. Okay, so this is a laser machine, Q-switch and DIAG, and it's well known for its treatment, particularly on hyperpigmentation, melasma, and also this one has this type of treatment or protocol for not only clearing the skin and reducing the pores, but also giving that toned skin. So we'll be starting with our quasi-long mode here, okay? And we applied the carbon gel lotion prior to this, and we left it for a few minutes so it's gonna adhere to the top layer of the skin. But of course, prior to doing any treatments, you have to do facial cleaning. So we did cleansing also. And then after that, we put on this carbon gel. And I'll start with this mode, okay? So Q-switch and the DIAG laser with a quasi-long. Or they also have the Q-switch PTP and the DIAG. Okay? So I'll start with the chin part here. So starting with just doing this, some shots to further help the carbon gel adhere on the superficial layer of our skin. Okay, So the goal is to peel off blemishes, pigmentations, any dark spots, age spots, and also to tone our skin, to balance the skin color, and to give that boosting on the superficial layer of our skin. So after that, we proceed with doing the 1064 wavelength. Okay, how does it feel, Jazz?
Okay lang, heat sensation lang.
Yeah, there's just some heat sensation. Or the others were saying na parang may tiny pricks na nafe-feel.
Yes
Okay.
po, pero it's not painful.
Yeah. Okay, the next one, it has a loud sound. So I'll start with the chin again. Yeah, this one is already removing the gel, carbon gel. So as you can see, instantly you're clearing off that carbon color. Yan. So the sensation, masakit ba, Jazz?
Hindi naman.
Hindi siya. Yan. Malakas lang yung sound. This one, I love it. If you're going to attend events, your skin will really glow. And it helps on lightening some of those pigmented areas. And it improves the texture of the skin. Yan. So, I can already see more glowing, more hydration on the skin of Jazz. So, naging effective yung management natin ng kanyang acne problem. So, we did actually combination. Aside from the topicals, we have oral medications for Jazz. Because acne has 4 pathogenetic etiology. Yung mga causes, 4. So, when you treat acne, you have to treat all those 4 causes. But the others are just doing facials for acne, but they're neglecting the other causes of acne. So, probably, we can discuss further pag natapos natin tong part na to. So, instantly, you are clearing the carbon gel with this one. So, it's painless, right?
Yes.
It's actually helping your skin restore its natural glow. And this one also minimizes the size of our skin pores. So, I'll go with the nose area. So, since nagkaroon ng non-surgical nose treatment, yung other people are asking kung safe. So, this is okay. Kasi we're only on the very superficial layer of the skin. So, no worries lang. Okay, so we're finishing off with our PTP 1064. So, yan, clear na. So, we have the third pass of our laser. Painless na painless, no, Jazz?
Yes.
Yan. So, we're continuing with this one. So, yung mga remaining na lang na carbon gel. And just do your passes like that. And actually, it's also good for those people who wants to really clear their skin from all these blemishes. And no downtime. That's the important thing. Walang downtime ito. So you can even attend an event. And marami ngayon na mga tao na ayaw nila ng may matagal na laser marks or grid marks from the laser. So this one is very excellent. You can do a treatment of this once a month, or you can even do it twice a month para talagang mag-improve ang skin texture, skin quality, and skin condition. So even for those individuals who are prone with acne or skin redness, this is an excellent type of a treatment. Yan. No downtime at all. It's painless and it gives that natural glowing result. So we have done carbon lucid laser, and we can already appreciate a result for Miss Jazz. Okay, so I can already notice more glowing on forehead, cheek area, chin area. Okay, so the next thing that we will be doing is the so-called injection of skin boosters or beauty boosters. Wow, exciting yan, Jazz, right? So, this is more of highlighting yung areas of our face that has this natural glow. So, most of the time, di ba, we highlight cheek areas. Like, women, we love to put some highlighting on this region of our face. Tama, Jazz?
Yes.
Di ba? Nilalagyan pa nga nila ng
Highlighter. Kasi yun daw yung
highlighters. Yeah, kasi
yung sa sun po. Yun yung it hits the yung sun na hits the spot.
UV rays, tapos nagre-reflect yung parang mga important features ng ating mukha, the attractive features of our face. So we're gonna do more of a highlighting right now and also give that glass skin effect or radiating effect. Okay? So we will be using skin boosters, specifically hyaluronic skin boosters. Yan. So we've already been doing hyaluronic injections in the past, and we're always doing volume restoration, face contouring, or treatment of fine lines, wrinkles. And right now, we'll be discussing about hyaluronic, that it is also good for boosting skin quality, improving skin integrity, and giving that glass skin effect. So exciting, right?
Yes.
So solusyon na ito sa mga taong katulad ko rin na kasi I was always applying topical regimen, skincare regimen. Dapat pala yung mga skincare regimen na yun, talagang everyday you do it. Dapat you apply it constantly. Kasi when you stop, wala na yung glow, wala na yung radiance. Yan lang if you're a busy person, you want something na longer lasting. Ang mga topical skincare, temporary effect. Kasi it's just on the outer layer, it sits just on the top of the skin. Once it's gone, wala na yung parang glow. Kasi if it's on the top of the skin, meron lang siyang glow effect pag nandoon siya. So we wanted something na it will improve the glow of the skin from inside. We're going to reach the dermis layer, inner layer. So longer lasting effect. Now where do we inject those skin boosters or those beauty boosters? Now, as I've mentioned, we wanted to highlight particularly the cheek region and also include na forehead and chin part. Yan. Yan yung mga areas na, kasi yung iba nag-highlight na rin dito, right? Dito sa gitna. And then, yung iba dito sa chin. So, attractive areas of the face. So, where to inject? Like, if on the skin, you have to identify the zygomatic prominence or malar prominence here. So, for doctors, we do is, we make a line from the corner of the mouth to the lateral canthus, and then from the ala to the tragus. So, nandito yung malar prominence sa area na to. So, wanted to give here an injection, and same thing on the other side. So, for doctors who are injecting this type of skin or beauty boosters, you have to have specific anatomical areas. Again, when you're doing your hyaluronic injections, make sure you know the anatomy. So this one, malar. So I wanted to give that highlighting again of the malar. For women, it's very good to have high cheekbones or fuller cheekbones. Dapat nandito lang yan. So and then, after that, you follow this line here. I'll be just be doing some tiny, it's more, ano lang, tiny injections lang. It's not a deep injection, superficial injection lang. So, itong areas lang na to ang injekan ko. So, I'll follow the same pattern, the same lines. It's like giving that hourglass pattern here. And then, minimal on the chin, and then minimal on the forehead region. So, I'm gonna use a product that is already known to us, the so-called Belotero Soft, to give us that glass skin effect. So we're doing our injection of our Belotero Soft to achieve glass skin. Okay, I'm gonna start in the cheek region. Okay, so we did a while ago markings to identify where the malar prominence is. So I am going to start in that region. So it's just an intradermal injection of our Belotero Soft. you have your injection on your malar prominence region. So this is intradermal injection, okay? And then we can make our pattern following that line from the malar area. Okay, a while ago we did the land markings and I already made my like in my mind I already remembered, right, Jess? So I'm gonna go now to the lateral aspect. So it's like following the zygoma region. Again, this is an intradermal injection. So we wanted to reach the mid-dermis or superficial dermis, because in the dermis layer you have your fibroblasts, you have your glycosaminoglycans, your elastin, collagen, all of those important molecules for the maintenance of our skin tightness, firmness, and always that youthful look. So I'm done on the right. So we are proceeding to the left side. Okay, before injecting, I noticed that Jazz has some scars here from chicken pox, right?
Yes, po.
Yeah. So we can also use this Beloterra Soft to treat the pox scars or even acne scars. I did already episodes on treating acne scars with hyaluronic filler. So actually wanted to inject also this pox scar here. Okay. So beneath that scar, you can already push your dermal filler. Okay. So this is a very easy techniques for our doctors. So again, your malar prominence here. So we wanted to give that youthful glow, radiance of the skin, a well-hydrated skin. Ang skin natin, Jazz, pag talagang well-hydrated, pigments cannot stay. Kasi you wanted also to clear your skin from all these pigmentations. Mga dark spots, blemishes, sunspots, and you don't want your skin to be dull looking or very rough looking or even sad looking. Yun. So we wanted to maintain a well-hydrated, glowing skin, radiant skin. So this hyaluronic, we already know that it is very hydrophilic, so it attracts water. So we're having another syringe of Beloterra Soft, and this is injecting into the dermis of our skin. So I'm just following a pattern, areas that you really wanted to hydrate or restore that hydration to give you that radiant skin. And of course, we wanted to also reduce the size of the pores. You wanted to make it less visible, right? So I noticed there's also this pox scar on the forehead region. I can also inject that with this filler. And the forehead region, we wanted to also improve the glow on the forehead. So youthful glow on the forehead region. So I just want to make a line here. So you notice it's a multiple injection here, and it's very tolerable because the filler also has lidocaine with it for our comfort. Okay. So this is very effective even for acne scars, not only to rejuvenate the skin, not only to restore glow and radiance, but it's also for treatment of those with acne scars or any scars on the face. So I also wanted to do this, it's like a meso hyaluronic injection over our face. So there are actually a lot of brands that has this skin boosting effect or beauty boosting effect. There's also the so-called meso hyal. There's also the Juvederm Volite. There's also Restylane Skin Boosters Vital Light. So this is Beloterra Soft. Also Chioxan has Redensity 1 and RH1. So those are hyaluronic dermal fillers. Okay, so you've seen here we've done laser, and then after laser we did this injections of our skin boosters or hyaluronic boosters. So we will show the result to Jazz when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we did first, the carbon Lucid laser, and after that, the injections of our beauty boosters or hyaluronic boosters in the dermis layer. So here's our Jazz. So we can see multiple papules or tiny bumps muna. These are very temporary. It's gonna clear in about 3 days time or even less. Okay, so how was the feeling, Jazz?
Very actually painless. Minimal lang, hindi naman painless. Minimal yung pain.
Some
parang
discomfort.
po. Parang ant bite lang.
Parang ant bite lang. Very tolerable.
Actually, ant kisses. More of.
Ant kisses,
more
I like that.
More ant kisses.
Yes. So the goal of the booster or the injection of our hyaluronic Veloterra Soft is to actually bring in the hyaluronic inside our skin, doon sa dermis layer. Kasi when we use our topical products, skincare products, na ina-apply natin all over the face, they just sit on the outer layer of our skin. So they just create a thin film on the outside. And they really do not totally penetrate the inner layer, where you need to boost some of the important tissue matrix of our skin to give that better glow on the outer layer. So this is beautifying from inside and radiating the skin from inside, right? So, kasi Jazz is also like you have routine na skincare regimen, right? But you have to do it every day. Dapat araw-araw. Kasi nung lockdown, every day I can really apply topical, like frequently nga eh. Meron parang 4 times a day, 5 times a day, 6 times a day. And then, when the time came na you went back to work, which you cannot do frequently na, ayan na naman, dry skin na naman, nagiging dull skin na naman. So, actually, this is a remedy for those people who are so busy na they cannot afford to do the daily, like 10 steps a day. And then, for you to really have that glass skin or talagang super radiant skin or talagang, ano ba yan? Very transparent, very clear skin. So, because this one is delivering a natural skin component, which is hyaluronic, into the inner layer. And then, inside the layer, also, you're stimulating other important skin molecules, other glycosaminoglycans. They also boost your skin's health. Okay, so this is hydrating from within. Okay, so with Jazz, we will be monitoring yung result, like 3rd day, or 7th day, 2 weeks, 3rd week, to a month, 2 or 3. Because this one will really give a longer lasting effect. Kasi you're delivering it inside already. Diba? So, the others who have a problem na, yun nga, sobrang dry skin, or yung iba, yung photo-damaged skin, or yung iba yung laging nag-chemical peel, or laging nagli-laser, na dehydrate ang skin. So, you need this kind of treatment. You've seen with our episode today, we did laser muna. And then after that, we injected our skin boosters. Yung laser natin, it was not the ablative type of laser. Kasi we were discussing kanina ni Jazz kung okay lang ba yun. Yes. So, we did the carbon Lucid laser. It's more of a toning. It's more of a superficial layer lang to clear the blemishes, those acne blemishes. Kasi, na-clear na natin yung acne problem ni Jazz. Just started with us, pimple ang pinaka-problem. Would you want to share a little bit on the journey on acne treatment?
Actually, since I think 2014, dun nag-start yung acne problem ko all over my face. Pero ngayon actually nag-calm down na a bit because of the treatment doc gave me. So, yun, happy naman ako with the results. Sobrang nag-improve yung skin ko na.
Yeah, because I remembered, or yeah, what was that? You sent me an like a messenger, some message lang sa messenger. She sent me photos, yung areas na merong may active inflamed acne. And yun nga yung concern din niya, parang mas nag-flare or dumadami. And also, you went to a lot of clinics?
Yes, I already went to several doctors and I used various products on my face, yung mga topical creams and mga toners po. Pero wala talaga nangyayari. So, yun, nung napunta na ako dito.
Yeah.
Just like magic.
Yeah, what's happening kasi yung parang you treat it and then may gumaling, may bagong lalabas. But we wanted a treatment whereby i-clear talaga natin totally yung ma-target talaga natin yung acne problem. That's why I mentioned a while ago, yung acne kasi, acne treatment, you have to target yung 4 pathogenetic factors. Yung number 1, yung oiliness. Number 2, yung hyperkeratinocytosis. Yun yung mga maraming dead cells or mga keratinocytes. Tapos yung 3, yung Propionibacterium acne, yung microbe. And yung 4th, yung inflammation. So, pag hindi po talaga naku-cure yung 4 na yon, nagre-recur lang po yung problem. Kasi kanina you're saying na, Doc, yung oiliness ba, kung okay lang ba mag-skin booster na oily pa skin. That's why I mentioned to you, you have to treat muna acne problem, oiliness, and then once we cleared all of those, then we can do our skin boosters, our beauty boosters using our hyaluronic injections. Yan. So, this is a remedy for actually, I could say, all of us. This is for all skin types. And even those individuals with problems of, aside from yung mga acne blemishes, yung mga may melasma or hyperpigmentation na talagang problem nila, it's been on and off, it's been recurring. I think we're gonna make an episode for that one. Now, what about for melasma or PIH or hyperpigmentation? We can also make use of our skin boosters, hyaluronic boosters, to deliver it from within. Take note, melasma is not just on a superficial layer, it's also in the deeper layer. That's why you have to target yung deeper layer. So, it's not just the topicals or yung daily skincare regimen. And I think I would really recommend that you also do some skin boosting from within. So, kailangan din yung inner layer. Do not neglect the inner layer of our skin where you need more of the boosting. And yun nga, okay lang yung tuloy-tuloy kayong nag-skincare products, but you will still need the skin boosting injections to sustain a longer lasting effect, to really have that glass skin. I would recommend more of these skin boosters. You'll be happier with the result of this one, and you'll really have a clear skin, transparent skin, glowing skin, healthy, radiant skin from within. Okay, so any parting message ating mga televiewers?
So, ayun kasi before, I've always thought na surface lang yung kailangan ayusin on my face. So, ang dami-dami ko nilalagay sa mukha ko, yet walang nangyayari. So, today I actually learned that you have to heal muna from within para maging okay yung outside naman.
Exactly.
Yes,
Thank
po.
you so much, Jess.
Thank you, Doc, for this again.
You're welcome.
Sobrang
I'm so honored that
Yes.
we have you with us. Okay. So, sa inyong lahat na may katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Derm Centre, or Instagram, CSA Derm Centre. Our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. Okay, maraming salamat po sa inyong panonood ng aming mga episodes. Asahan nyo po, meron pa po kaming mga bagong isi-share sa inyo. Okay, hopefully, Jazz will visit us again.
Oh, surely.
We will follow her up next episodes. Abangan nyo po yan. And if you want to see the other topics, yung ibang discussions, we have our YouTube channel, Contessa Salvador. And please do click the like and subscribe as well to keep you updated. Okay, so maraming salamat. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.